This program at UC San Diego is a sports medicine course. It's a summer session, and our goal is to just educate students on the field of sports medicine in the medical world, and be able to provide them some information about anatomy and physiology, get a better understanding for human movement. So what makes the program unique is the fact that they get hands-on experience. They get to learn what the bones feel like. They get to work on each other, learning how to tape ankles.
The main reason why I enrolled in this program is because I'm an athlete myself. I do competitive dance. And I've had a few injuries in my life, and I think that it's really like the trainers, like the people on site who have like treated me and wrapped me at competitions. And so I just wanted to be able to know that information so I can help myself and help my teammates.
I'm also in the sports medicine pathway of my school. It's like my third year in there, and I've learned a lot. I also want to experience like sports medicine teaching outside of my school, and that's why I'm here.
You want to lay your tape down to make sure it's staying in contact.
Dr. Brittany, she works in the clinic at San Diego, and it's like really exciting to hear her about like she share her experience in the field. Right now, we're learning how to tape ankles, wrists, how to like stabilize joints, and that's like really applicable to real life.
And then from there, push. So what students are going to gain from the program is introductory level education on human anatomy, different joints, different bones, muscles. They're going to learn where they attach and what their actions are. They're going to learn about human movement, so the fact that the body moves in 3 planes of motion. They're going to learn about how to prevent injuries by doing some rehab and learning different exercises of therapeutic modalities that they can use with patients and athletes. And also they're going to learn about the careers that could go along with this type of a profession. So whether or not they want to go into the field of sports medicine specifically, they can go be a physical therapist, they could be an athletic trainer, they could be a physician, an orthopedic surgeon, physician assistant.
I think what really excites me is kind of like the hands-on stuff, like wrapping with tape. We did like wrists and ankles, elbows, and then we went over very common injuries for athletes and kind of how they arise, how you would treat them, the therapies, how to treat them in the moment, and getting people off the field right away.
This program gives me more about like a realistic approach, like how we're gonna go to like college or what we're gonna do for this profession after high school, because I'm definitely really interested in kinesiology.
We have international students, we have students from all over the country, students from different cities within California, and so they're all coming together with this same goal in mind of wanting to learn more about sports medicine. So all of that on top of also connecting with professionals in the field, and I think that's really something unique that not your average high school student gets to experience.
Ligament? Yes, anterior talofibular ligament, okay.